Good morning, all. We are going to see introduction of exercise therapy. Let us see to the exercise. Assisted exercise, free exercise, assisted and resisted exercise, and resisted exercise. We will see the passive movement. Second one is a relaxed passive movement, passive and manual mobilization technique, and mobilization, manipulation, then stretch. Then first we are going to see active movement. The movement which is done by the patient himself is said to be an active movement. Active movements are the voluntary action of the muscle. This may be classified into four variants, that is assisted exercise, free exercise, assisted and resisted exercise, and resisted. Then let us see assisted exercise. If the strength or the coordination of the muscles is insufficient to perform an activity, the external force is utilized to compensate the lack. The muscle has the strength and endurance, but is not sufficient to perform an activity or control an action. Assisted is manual, then active exercise, then we can do it the passive and assisted and mechanical. We can use the weight and the resistance. Then assisted exercise is divided into two. It's manual and mechanical. This manual exercise is divided into two. There it is active and passive movement. Then type of assisted exercise. The assisted exercise can be performed manually and mechanically. Again, the manual assistant exercise having the two divisions, that is active and passive. Active assistance, the patient himself can assist with his opposite extremity to perform the assisted exercise. For example, the opposite leg is used to the patient to increase the flexion of movement of the knee in long sitting or the prone lying position. Upper limbs are used to move the lower limb in opposite side of upper limb. We can give the pressure in the normal leg, ask the patient to do the movement assistant. Then passive assistance, it is classified into manual assisted exercise and mechanical assisted exercise. First we will see manual assisted exercise. The passive assisted may be given by the therapist or by any of the medical professional, sometimes by the patient, relative or friends. This type of assisted exercise is the maximum passive in nature. The patient has to try perform the movement up to his ability. Then second one is mechanical assisted exercise. Let us see, we will know it, the mechanical, we can give it the pressure with any assistant or the machine. We will give it the pressure to get the resistance. The assisted exercise is done with the help of mechanical device or called mechanical assisted exercise. Suspension therapy, pulley, spring, and some of the example for the mechanical assistance. The same can also be used for the resisted exercise. Okay, what are the principles? We can see the principle. First one is the range. We are doing the exercise, assisted and resisted exercise, active and passive exercise. There it is a principle. We can see it. First one is the range. The assistance given is the changeable, depends on the range. Normally in beginning, the end range, the muscle strength will be less while comparative with the medical range. So that the assistance provided should be more in the beginning, the end range, than the middle range. Then second one is command. We can give give it the proper commands, we will get it the proper actions of the movement. Some commands is needed to activate the patient and perform the effective movement, and command given the perfect guidelines to the patient to practice an activity. Then third one is concentration. Concentration of the patient is the must in the assisted exercise, and otherwise the movement will be passive in character. Therapist has to make the patient to concentrate the treatment well for effective performing the assisted exercise. Then speed, we will see there it is a speed. Determine the assisted exercise more to speed increase, it shows the passive character, and also the patient cannot top up the movement. Then repetition, the movement has to be repeated so that the joint range and the muscle power can be improved. We can ask the patient to do the repetition movement to get it the range and the muscle power of the patient. Then what are the uses? When we do the exercises and active and passive exercises, what are the uses? We will get it to increase the range of motion of the joint, increase the strength, power and endurance of the muscle. It breaks the adhesions formation around the joint. It reduces the spasm of the muscle. It strengthens and tightens the soft tissues. It remains and coordinated movement of the joint or the muscle. Increase the blood circulation and venous return to the joint and muscle. Okay, let us see once again. We can do it the exercises, active and passive exercises. If there is a branches, we can do it assisted and resisted exercise. We will get it the power to increase the range of motion of the joint, increase the strength and power endurance of the muscle. It breaks and adhesions formation around the joint to reduce the spasm of the muscle. It strengthens and tightens the soft tissue. It remains coordinated movement of the joint or the muscle. Increase the blood circulation and venous returns to the joint and the muscle. Thus we will get it to do the exercises. Okay, let us move the free exercise. How we can do it the free exercise? What are the uses? How we will do it? Let us see that. These are the exercises which are performed by the patient himself without any assistance and resistance by the external force except that gravity. Without any assistance and resistance, they can do it its own. That is called free exercises. There will not be any manual and mechanical assistance or resistance given is this type of exercise. Manual means we can give it the pressure to the patient to do the activity. So we want to do it the activity, to gain it we won't give it the pressure. They can do it own. Then mechanically we can use some tools and machines. They can do it the exercise. We won't not apply for that one. Do it the exercises. It is much more useful for the home program schedule. The patient can perform without depending on anybody. They can do it own. So anybody can do it. It's very easy to gain the free exercise. There are two types of free exercise. One is localized and general body exercise. General body exercise. First one is going to see the localized. The localized free exercise plan and formed to perform improve on one particular joint and increase the strength, power, endurance on one group or particular muscle. For example, we can do it the exercise for the shoulder joint. We can do it the exercise to focus that one to gain the muscle power and the range of motion to get it freely that action. For example, exercise to the knee joint, free exercise to the shoulder flexors. Then general body exercise. These type of free exercise are formed to increase the joint range in multi-joint, to increase the strength of many group or the total body muscle. So we can see it before we will see, that is the localized body exercise. Now we are going to see the general body exercise. The difference between, we can do it the particular point. For example, there it is a knee joint, we can do it the exercise that the point we will get it the power and the range to recovery that action. This is the general body, we can get it whole body action. We will do it the group muscle exercise. For example, jogging and relaxed walking, training of the whole body. Then characteristics of the free exercise. There are two types of characteristics for the free exercise, namely subjective and objective. Subjective, it means performing the movement within the perfect perfect anatomical range and the pattern. Patient has to concentrate to the perfection of the movement which he performs. Objective, there will be some goal to achieve in the exercise program, but not spoiling the perfect pattern and the anatomical range movement. For example, bending and touching the great toe with the middle finger. Here the goal is set to touch the toe. So we ask the patient to do the particular exercise. We discussed the example, bending and touching the great toe. The patient to concentrate, try to focus to touch the toe. Then uses, what are the major uses when we do it these exercises? Increase the joint range, then increase the muscle strength and power and endurance, increase the neuromuscular coordination, increase the circulation and venous drainage, increase the relaxation of the muscle by the swinging movement and the pendular movement. Okay. Then repeated active movement breaks to additions, formation and elongate the shortened soft tissue. We will give it the repeated action, the particular joint, for example the shoulder. Ask the patient, we can do it the free exercise, flexion and extension. They can do it the repeated action, it will break the additions and elongate the softening of the tissue, that particular joint. Then regulating and cardiorespiratory function, that the active exercise increase the respiratory and venous return so that oxygen supply to muscle and blood circulation to muscle increases. So the resisted exercise, we are moving to the resisted exercise. The activity which are performed by opposing the mechanical and manual resistance, it is called resisted exercise. Already we discussed the previous portion. There is a mechanical and manual resistance. So we can give it the manual and mechanical resistance to gain the resisted exercise. Then type of resisted exercise. There There it is manual and okay, we will see the manual resisted exercise. In the manual resisted exercise, the resistance can be applied by the patient himself with his opposite extremity. Otherwise, it may be taught to the patient to like his relatives or friend. This will be helpful for home exercise. This exercise can be operated by the following individual. The therapist, they can do it to support the patient to gain the movement to get to the normal power. Then patient himself, they can do it. Any other medical professional, they can do it, support to gain the movement. Then relatives and friend to support to gain the movement. The mechanical resisted exercise. The mechanical devices are used to oppose the active movement to person is called as mechanical resisted exercise. What are the things we can use to perform the mechanical resisted exercise? The weights, springs, pulleys, and what are these kind of things we can use to gain the resistance? Then uses of resisted exercise. When we do the resisted exercise, what are the changes, what are the uses, we will get it in the patient. The resisted exercise to increase the strength of the muscle earlier. The weak muscles can be strengthened much earlier than any other exercise regimen. Increase the endurance of the muscle. Powerful muscles contraction increase the blood flow of the muscles fiber and it gets nutrition of and the oxygen level. Resisted exercise increase the muscle power. Power is related to the strength of the muscle and the speed. Power equal to force into distance and time. Then progressive resisted exercise. While performing the resisted exercise with the weights, it is very much difficult to find out how much weight has to be used and how many repetitions to be done by the injured patient after recovery. We can do it the performance of the resisted exercise to do it the exercise with weight and how much weight we can use it and how many repetitions to be done by the injury of the patient. Then to come out the situation to form the exercise regimen to improve the muscle power and strength power to the endurance. As per this regimen, the weight is gradually increased and also he explained to about how many repetitions to be to be practiced. When we started to the resisted exercise, we can apply the minimum power, minimum resistance, minimum weight. We can do it to start it, that exercise. But they can achieve, they can do it the exercise. After that, slowly increase that weight to do it and repetition of the practice. Then repetition maximum. The maximum amount of weight person can lift throughout the range of motion exactly 10 times. Some others and recommended to lift between 6 to 15. The considering as per the repetition maximum. The exercise regimens may vary depends on the condition and disease from the patient to another. It's not the same. It's patient to patient. It will be differ. We can use this weight and repetition according to the patient. We can set it. Okay. At present, three types of progressive resisted exercise regimen are available. What is DLOM and the Hawkins and the McQueen and the Sunmoy and the Osborne techniques. These are the three techniques we should follow for exercises. Okay, so basic things we can discuss in this class, we can cover in the introduction of the exercise. So okay, let us do it and see that one and discuss for that the classes. Okay, thank you all. 5 seconds.